My name is Mark Hackett. I'm the CEO for the Jane Pauley Community Health Center, and I wanted to welcome you to our newest site here, located inside the historic Wigwam building. We're super excited just to be a part of this wonderful project that's going to transform this historic city landmark. It's great to be just not only a part of it, but to see the transformation of this building, and so we can utilize it again for the healthcare needs for the community here in Madison County and in Anderson.
Good morning, ladies and gentlemen. Thank you for being here today for this great occasion. As you know, those of you that are from this community, the Wigwam has been a big part of this community for many, many years. There's really no one that lives here that has much age on at all that doesn't have a lot of fond memories about this facility and all the great things that it stood for here in Anderson. And so when Gary and his group looked into what they could do to try to help bring the Wigwam back, it was an exciting thing. And the fact that Jane Pauley and Mark and their organization has stepped up to become part of this great facility is exceptional, and we appreciate that. And I know Joanne and the folks with Work One have been working with Gary on some other ideas that they might be able to do to help continue to make this a great facility. But as far as the Jane Pauley organization, who's become an integral part of our community, we want to say thank you to you. As you know, they are working off of 38th Street in the dental facilities out there, and now that they're opening up the health clinic here, as you know, for a few months as they were getting ready for this, they were doing a temporary work outside, and I know they had a lot of patients there, and they've continued to grow, and I guess been open about 3 weeks, Mark said now, as far as sort of soft opening and working with patients, and I know they're doing a great job. Anderson and Madison County have been very fortunate over the last several years to have some really quality healthcare opportunities available to folks when it comes to community health, and Jane Pauley will become a very integral part of that, and we appreciate everything they're doing. So on behalf of the City of Anderson, let me again welcome you back into our community. Thank you for your continued growth and investment here, and thank you for all that you do for the people that are in need here in our community. And thank all of you for being here today. Thank you.
This looks so different. I've spent a number of years here in the Wigwam, one as a 20-year employee of Anderson Community Schools, and then just as a community citizen where it was, you know, everybody knows the story of the Wigwam and everything that went on here, but it looks fabulous, and you guys have done a wonderful job making it a welcoming environment. Well, I'm going to ask you to kind of change your frame of thinking for a second. You know, we're all here to celebrate not only the work of Jane Pauley, but and the beautiful transformation of this building, but I also want you to think about a community's health as an economic development driver, because primary care and access to quality primary care really is the cornerstone of a healthy, thriving community. And a healthy community actually equals a strong, thriving economy. I will never forget being a freshman legislator, and it was then Dr. Richard Feldman, who was the head of the Indiana State Department of Health, came in to do his budget presentation. I was on Ways and Means at the time, and you know, one of the things he said is, you know, in Indiana, we actually at that time were fourth from the bottom in terms of health outcomes. Now, I want you guys to remember, this was back in 2003. And he said, you know, our economic development efforts as a state are really challenged because when you have that kind of ranking, your insurance premiums are higher, it's a higher cost for employers, and they think twice before they come to either your state or your region, or in this case, our community. Now, we've had some tremendous successes. Thank you to the mayor, to the team that works diligently to try to rebuild Anderson's economy, and they've got some great things that are moving forward. And the good news is that our nation really does continue to experience declines in the prevalence of smoking, the rate of preventable hospitalizations, and the percentage of the population who are uninsured, which are three of the primary drivers that the World Health Organization reports on every year. And according to the WHO, what we know is since 1990, the prevalence of smoking in the United States has decreased 41%. 41%. And that's because a lot of the tobacco manufacturers have moved their marketing strategies overseas, to Europe, to China, other places, because of some of the regulations and just public awareness and public pressure. and which is actually a 17% decline over the last 4 years. But here in Madison County, 20% of our population still smokes. And also during the last decade, the rate of preventable hospitalizations among Medicare enrollees has declined 35% and 13% again in the last year. Beth, I know that you at Community Hospital I know the pressure you're under in terms of making sure folks aren't readmitted because you get dinged if it's within 30 days, dinged on your Medicaid reimbursement. And then also the percentage of the population that is uninsured declined 35% over the last 5 years and is now at the lowest point in the World Health Organization's 27-year annual report history. Here in Madison County, we've had great strides. We're at 14%. But there's still a lot more we need to do. And the not so good news is, I'm going to stand here and say it, we're overweight. We are overweight. Our cardiovascular health is not good. We have 26% of Madison County residents who simply aren't physically active. No physical activity at all. And our drug deaths have increased, and we all know the stories of those sad stories where opioid addiction and other drug use and abuse have claimed the lives of too many, not just young people, but even folks middle-aged and sometimes older. So as we continue to try to, one, celebrate our successes, and I do think that's important, what we also need to do is take a serious look at ourselves. Thank you to the folks who are working so hard to bring the community who got the grant, I think from the EPA, to help look at Madison County and Anderson and as part of our health infrastructure. Thank you, Mayor, for the repaving of Shadyside Park. It's been long overdue, and that is one of our, I think, hidden jewels in this community. And one of the things we need to try to focus on is reducing the number of premature deaths, because in our county in particular, we're near the top, at least in the top third of counties where folks die too young and unnecessarily.
Wow, thank you all for coming today. Had a great turnout. I am the site manager here at this facility. I also manage the site in the 1210B building behind Community Hospital Anderson, and I'm also the site manager in Alexandria on Washington Street. I came to Jane Pauley almost 2 years ago because I wanted to make a difference in people's lives, and I'm still here today because I believe that's what we're doing in this community. I think we're making a positive difference in many people's lives. I'm very excited to finally open our facility here at the Wigwam. It's been a long time coming, and to be in a historic building is even better. And I don't feel that way because I work for Jane Pauley or because I manage this center. I'm excited because we are filling a need in our community. We're making healthcare more accessible. It's coordinated healthcare, and we're going to meet our goal in ensuring that every person has the resources they need to stay healthy and establish a medical home. At the Wigwam, we have a family medicine nurse practitioner, Audrey Johnson, and she was out here. I think she's in the back now. Audrey will serve patients of all ages, from pediatrics to geriatrics. We also have a full behavioral health staff from Dr. Sharon McNeely, Dr. Aaron Davis, and several doctoral and practicum students. We also have an enrollment counselor here, Jessica Matchett, and she works with patients to help them navigate the complicated Medicaid, HIP, and marketplace applications. And for those that don't qualify for those government programs, she works with them to analyze their income and figure out their financial liability to us according to our sliding fee scale. Jane Pauley Community Health Centers in Madison County are a full service provider between our dental services at the D26 building at 38th and Madison, our OB and GYN and pediatric services at our 1210B building, and family medicine in Alexandria, and now here at the Wigwam.
Set up and ready? 1, 2, 3.